The following segment is sponsored by NeuroPace. November is Epilepsy Awareness Month. Dr. Danielle Becker is joined by Lauren, an epilepsy patient, and Lauren's mother, Maryanne, to discuss the prevalence of epilepsy and its impact, and how we can advocate for improved treatment options. All three of you, thank you so much for being on the show today.
Thank you for having us.
Thank you for having us.
All right, Dr. Becker, I'm going to start with you. What is epilepsy, and what are the risks of uncontrolled seizures?
So epilepsy is one of the most common neurological conditions. It affects 1 in 26 people in their lives in the United States. And it's characterized by seizures, which are caused by abnormal electrical activity in the brain. And if this is uncontrolled and continues unpredictably, it can cause a lot of issues, including problems with memory, with cognition. It can cause limitations in education, employment, driving, as Lauren can speak to personally. And it also can cause something called sudden unexpected death in epilepsy, which is really the reason why we want to make sure that we are informed and aware of these advanced treatment options, with our goal being to try to greatly reduce and even stop the seizures if we can.
Okay, Dr. Becker, that leads me to my next question. Why aren't more patients without seizure control receiving advanced therapies?
So that's a good question too. So sometimes it's because of location. They might be in an area that isn't close to an epilepsy specialist and or an epilepsy center. But a lot of times it's because they don't know to ask about it, right? And they might be seeing someone who hasn't been trained in epilepsy. So we actually encourage people to ask to be referred to a specialist or seek a specialist out. That's someone who is trained in epilepsy, called actually an epileptologist, who's been trained in all the latest evaluation and treatment options, and especially options beyond medication. So for example, if someone fails 2 or more medications, the likelihood of them having controlled seizures is less than 5%. And so then they might be a candidate for surgery or neuromodulation. An example of neuromodulation is the RNS system, responsive neurostimulation system, which is actually what Lauren has. It's an implant in the brain that senses any abnormal electrical activity. And so it senses the start of a seizure and it sends electrical impulses to stop the seizure within milliseconds, ideally before Lauren would even feel that she has a seizure.
Okay, so Lauren, we've been talking about you. Really quickly, this is what you are living. This is what you're experiencing. What kind of limitations have you experienced with epilepsy?
I have severe short-term memory loss, and because of that, I can't drive. School is very difficult for me. It also limits the type of jobs I can be successful at.
Mm-hmm. All right. Well, Lauren, thank you so much for sharing. Dr. Becker, thank you so much for explaining more about the disease and how people can get help. All three of you, thank you so much for being with us today.
Thank you for having us.
Thank you.